What are the hairs in your ear called?
Cilia?
Yeah, the cilia. Do you run the risk of ripping those out
So,
with the earwax? Well, not earwax, but with candle wax?
Kevin, we're going to have to go over ear anatomy again.
Okay.
So,
Fair. I mean, we should probably do that every single podcast, if I'm being honest.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Allie and Kevin Ziener.
It's another Monday, and that means it's time for your weekly dose of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Allie Tressiter.
I'm excited for today's topic. Allie's excited for today's topic.
I'm pumped up.
It comes to us from Dr. Deanne Rudden from Longmont Hearing and Tinnitus, and it's about candles and tinnitus, and earwax, and hearing loss, and all the good stuff that goes along with it. 2 things, 3 things, 4 things, 5 things that we have surprisingly made reference to on this podcast before, candles included.
Yes.
So, Dr. Allie, explain to me how in the world we go from tinnitus and earwax and the eustachian tube and ear canals and the eardrum, and then somehow we just incorporate a candle into the whole mix.
Sounds weird, right?
Yes.
That's because it is.
Yes.
So
Stay tuned for more.
So hear me out. Let me pose a scenario for
Mm-hmm.
you, right? If I said, Kev, listen, I'm going to give you this candle, and what I want you to do is light it on fire and then stick it right next to your head. How would you respond to that?
I would blindly follow you because you're a doctor.
Well, that's a mistake.
Okay.
So
Don't trust your doctors, kids.
Do not. Well, if they're telling you
Don't
to
trust
put,
these doctors.
If they're telling you to put candles by your ears, run.
Got it.
So do not do it. So
Fair.
let me start with the idea behind it and then why you shouldn't do it.
Okay.
So ear candling. For those who don't know what it is, it's essentially, obviously you've got a candle. It's usually one of those longer candles. And I've seen it done a number of ways. It can be paper, or a lot of times people use a paper plate and they roll it up into a cone.
Okay.
Right? And so the small piece of the cone will go right into the ear.
Mm-hmm. Like a little funnel.
Essentially. And and the cone kind of opens up, and then you put the candle also right up against there with the lit side out.
Got it.
Right? Not in.
Flame in the ear. Got
Not
it.
in. But
again, she's the doctor. I'm just the idiot who hosts the show. If you have any mail coming to her because you put the wrong side of the candle in your ear, it goes to Dr. Allie.
Listen, I recommend doing a little Google to see what it looks like, just to know how ridiculous it is. So,
And it is.
It is really ridiculous. And so essentially, then you light the candle. The idea behind it is that because you have heat outside of the ear canal, you're essentially creating a vacuum that is going to pull the wax out of your ear.
Sure, makes sense.
And I've had people do it and say, listen, I saw all the wax that came out of my ear. You can't tell me that it doesn't work, that it's not real.
Wow.
No.
Wow.
It's not real.
Sure.
It's usually burnt paper or from the wax of the candle, but there is no evidence showing that it is a real treatment for earwax
It
removal.
feels medieval. It's something that's like, and if that doesn't work, we're going to shove leeches in your ears.
Yeah, it's one of those things that so I was in the Army, and I've treated a lot of 19, 20-year-olds who spend a lot of time on Facebook, and they say, oh my gosh, I've seen all of these videos, and multiple people have done ear candling. And I've had multiple of those patients have the wax go from the candle, drip down into the ear canal. I've seen holes in eardrums. I've seen burns along the ear canal. It's horrific.
I fundamentally don't understand the physics behind it because now if you were to tell me, and again, don't do this, do not do this, that if you were to put the flame end at least close to your ear,
it does have to be close.
The warmth would heat up the wax from that angle. I don't understand how creating a funnel, putting the butt end of the candle in your ear, and then the flame going out, how that somehow heats up your ear.
The flame is still close to
enough.
the ear. Like it's not like it's like one of those
These aren't
candles.
2-foot candles?
Yeah,
Okay.
no, it's still close to the ear, so it's still generating warmth within the cone. And listen, I'm not gonna knock what people did years and years ago to try to find
back
a
in the
solution.
90s.
Right? Yeah, totally. It was probably totally a 90s thing. But this, no matter how many YouTube videos you see with this, no matter how many times you see it on Facebook or people advocate for it, don't do it because the risks
Yeah.
far outweigh any potential
There have to be
benefit.
a ton. Like, I'm not even talking about just like hearing health risks. Like, you have an open flame next to your face type risk, right? Like, there's burning and scarring and an ER in your future if this thing even goes mildly wrong. And I've also seen the paper plate thing. Paper catches on fire.
It's flammable. Did you know?
And it's next to your face and your hair. So the idea that you would put a flame next to something that is, I believe the technical term is combustible, next to your then face is wild to me.
And I mean, at the very least, like everybody knows the smell of burnt hair, right? And we all know that it is one of the most foul smells ever. And so, like, if no other reason, just don't do it because you don't want to burn your hair and have to smell that smell.
If you had to put like your brain in somebody else's to wonder how ear candling could even help tinnitus, like what could you even hypothetically assume ear candling is doing for tinnitus?
So the purpose of ear candling has always been to remove wax from the ear.
Okay.
Now, when you have wax, let's say you have wax in your ear and it's impacted, it's essentially blocking your ear canal. We've talked about before that can cause a perceived hearing loss. It's temporary, right?
Yeah.
But when you have a hearing loss, whether it be temporary or otherwise, if you also have tinnitus, even if you can't hear it, without the hearing loss or without the wax, if you have tinnitus and now all of a sudden you've got this little bit of hearing loss, the light essentially is shining much brighter on the tinnitus, right? So you're not getting as much external stimulation as you used to get.
Okay.
And that's why people will say even like when your ear gets plugged on an airplane, right? We talked about how that's your eustachian tube not opening. That because the eardrum is taut and it doesn't vibrate as much, that can cause a perceived hearing loss and thus make tinnitus seem worse.
Got it.
But it's temporary,
Sure.
right? And so wrapping it all together, the idea, right, is that we're taking out the wax, which is going to get rid of the temporary hearing loss, which is going to alleviate the tinnitus.
And again, we've talked about earwax on this podcast a lot. Like, earwax is good for you. It's supposed to be there. Obviously, it can get impacted and it can go bad. But if you think that you have a level of earwax that lighting a candle on fire and putting it next to your ear is going to help, that, my friends, is the canary in the coal mine of you needing to go to a doctor.
It very much is.
Not candling.
No, please don't do it. No matter who says it's great, wonderful, just don't light something on fire and put it next to your head.
Yeah. But be honest with me, have you actually ever done this yourself?
No.
Have you actually seen other people do it?
I've not seen them do it in action. I have seen many people with the repercussions of it. Because again, I was working with a lot of younger people who you see something on YouTube and you want to do it, right?
What was the worst outcome you saw of this?
I've seen an eardrum that was pretty much the entire thing was covered in wax from the candle.
So when you have that happen, and I know there's like, what are the hairs in your ear called? What are the little baby hairs?
So like cilia?
Yeah,
Like-
the cilia. Do you run the risk of ripping those out
So
with the earwax? Well, not earwax, but with candle wax?
Kevin, we're going to have to go over ear anatomy again.
Okay,
So
fair. I mean, we should probably do that every single podcast, if I'm being honest.
the issue really ends up being mostly outer ear,
Okay.
which outer ear, you've got small like baby hairs in the ear. But when you're thinking cilia, what I'm assuming you're referring to is more in the inner ear and that cochlea, the hair cells there.
Yeah.
I mean, technically, I guess if you had enough damage and you burned through the eardrum and into your middle ear space, you could, which totally possible because wax is hot and your eardrum is super thin. It's possible you could end up dripping it into close to the inner ear, but more than likely it's going to be your eardrum that's affected, or if it's really, really bad, it could get into those 3 bones in the middle ear. What are they?
Ooh, the hammer, the javelin, and the other thing.
The javelin, really?
Isn't there a javelin-esque name to one? The hammer,
The incus.
the Sagittarius, the Columbo is what I
I can't remember what the layman's terms are, but they're the incus, the malleus, and the stapes.
Yeah, I was close with the javelin.
Ossicles. Yeah, I think.
That's like they feel Greekish.
Yeah, I mean,
Olympiad.
but I'm thinking about so I obviously know how they're shaped, and I can't.
But they're small, right? Like they're the smallest bones in the body.
Smallest bones in your body, but none of them are shaped like a javelin.
Okay.
So
That's another
Close,
L for
but
Kev.
no cigar.
Here's the takeaway from this podcast. It's not that I don't know all the inner workings of the ear. It's that under no circumstances, none, zero, none whatsoever, in this day and age, in 2023, at no point should anybody be lighting a candle and sticking it anywhere in, near, or around their ear, face, hair, body.
If people take nothing else from all of these podcasts and everything that I've said, it is do not do ear candling.
Yeah. It is meant to set the mood, not treat anything.
Yes.
Besides maybe depression.
It could.
If you go on a nice candlelit dinner.
Yes. Or bathtub, some bubbles and some candles.
And to learn more about what you should not do with your hearing loss or tinnitus or anything of the like, head on over to askanaudiologist.com. Dr. Allie, thank you so much for sometimes pointing out even the most obvious things.
Kevin, I'm here for you and for everyone.
Let's go light some candles. We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
And is that loss worth, you saying like, I would rather just not wear the hearing aids?
Right.
Like, you know what I mean?
Also, credit me for not giving the joke answer, which would have been, yeah, I can go without hearing my girlfriend. Credit me for not saying that. Credit me for giving the real answer, which was, I would be very sad. I would be very devastated.
I give you props for that.
Thank you.